deep breath in and let it go.
Ah! Oh. This one a little bit, my arm inside.
You just feel, okay, right there. Okay, now go far back as you can. Okay, so it's laterally bending this way. Does it feel like it's hurting more on this left side?
Yeah.
And it gets up to, out of 10, what does it get up to?
Yeah, it's 8.
8 out of 10. If I turn that way versus this way.
Ah.
Got it. Let's go ahead and go face down. Right here. I'm just leveling you out here. Relax those shoulders. There you go. Okay, are you getting any sharp pain on that right side there? See, they're both pretty tender though.
Yeah.
With the right side. Okay. Okay, take a deep breath in and let it go.
Ah! Oh.
Perfect. Take a deep breath in. So far, so good. Let's lie on your back, please. Going face up.
Oh. My still.
Okay, so right there.
Oh. Oh my gosh.
Perfect. Let that go.
Oh, it's a big one. Oh my goodness.
Okay, so we're just gonna decompress all the spasm build up there.
Yeah. In the right side, it's tender. Oh.
I don't hardly feel any swelling though. So we have the opportunity for some massive change today. 2 more big deep breaths. Really feel, just let it go through the exhale. Good. Nice. Okay, good. Let's have a seat at the bottom of the table. Put your feet flat on the ground. Interlace your fingers behind your neck. So we're gonna open up the mid-back more, releasing as much spasm. Relax your shoulders. Drop that down there. Okay. Okay, drop those shoulders down. Okay. See here. Just let that go. Go ahead and lie down. Drop your head further.
Ah! Oh my gosh.
Okay. Sit up nice and tall. Okay, you're looking good. Now, look at me. Let's take a couple deep breaths here. Move your neck with me, like so, forward and backwards. And less swelling, the more we move our neck, the more we push some healthy hydration into those joints. Those muscles can relax while the change is taking place. Okay, go back a little further each time. You don't have to push it, just allow it to acclimate. And 8 out of 10, that's really severe, so we want to just let it ease in, okay? Let me show you what I like so far. You're not doing this anymore, so you're going straight back. So let's keep doing that. Let's keep reinforcing that.
Still in this side.
Percentage of improvement, what would you put on that?
Okay.
How much change do you feel different?
No, like 7.
Okay, down to the side. Okay. Okay, now look up.
Oh, yeah, much better.
Yeah.
Uh-huh.
Okay, so go ahead and relax there. When you do your breathing, I want you to really practice bringing your chest up. When we do that upper back adjustment, it's not quite holding that position yet, but the more we work it and the more neck extension we'll get, the easier it will get, okay?
So what
But everything's
happened with
moving
me
good.
was spasm?
No, it's a mechanical issue. The spasms are secondary. So don't go, trying to beat yourself up working out spasms or anything. That's not gonna do anything. Just go for a nice walk, practice expanding that rib cage, taking deep breaths, and icing your neck and keeping that movement. And it's gonna, seriously, overnight,
Okay.
be a good 50% better, okay?
Okay, thank you.
All right.